Hi guys! Now we're going to talk about why we care about clearance. I want to make sure you care because it's going to get a little sticky, and I want to make sure we are on the same page about what clearance is and why we should care. Clearance is an interesting thing, and it's important, as you know, because it affects both our CSS average and our half-life. Therefore, we're going to have to make changes in both dose rate and dose interval when there's clearance changes. But what exactly is clearance? The definition of clearance is the amount of blood where we can remove all of the drug per time. So it's the amount of blood where all the drug can be cleansed from it per time. So it's in terms of the amount of blood. So it's a volume of blood that can have all the drug removed from it per time. So the units of clearance are volume per time. So this might give you pause because you might have been thinking of clearance as an amount of drug that can be removed per time. So then it would be amount per time, but then that would be a rate, wouldn't it? This is not a rate. It's actually like a flow, isn't it? It's not a rate. It's not in amount per time, like milligrams per hour. No. It is in volume per time. So it's almost like a flow or an efficiency. We'll talk more about this, but that's the first thing you kind of have to try to get your head around is that clearance is in volume per time, and usually it's in liters per hour or mils per minute. We know it's important because it determines CSS average and half-life, which is going to be important in helping us understand our dosing regimen and changes we should make. So now we should ask yourself, so remember we've talked about the fact that we have that bioavailability, volume, and clearance all determine our dose rate and dose interval, which helps us to determine if we should make dosing regimen changes. We've talked about F, right? F is determined by FA, FG, and FH. We've talked about volume. Volume is determined by plasma protein binding and tissue protein binding, right? Now we're going to talk about clearance. So what determines clearance? What are the determinants of clearance? Well, here are some equations that we can use to calculate clearance, right? We can use clearance is equal to bioavailable dose rate. This is another way of saying dose rate, isn't it? Dose divided by tau is the same thing as dose rate. I've been writing it like that because I think it's a little less confusing than putting in dose over tau. But notice it's the same thing, right? So bioavailable dose rate over CSS average. That's one way to calculate clearance. It's the same thing. It's just a rearrangement of our good old CSS average is equal to bioavailable dose rate over clearance. We've just switched out these two factors. Right? Another way to, but we can calculate, this is mathematically correct, but we just don't want to think that that's determined by these things, because it isn't. Is clearance determined by bioavailability? No. Is clearance determined by CSS average? No. Is clearance determined by dose rate? No. How about this one? This one you use a lot, don't you? Clearance is equal to volume times K. Is this mathematically correct? Yes. But is clearance determined by volume? No. Is clearance determined by K? No. This is not the dependent variable. We can also, this is how we usually determine clearance. We'll give an IV dose and we'll measure the area under the curve that's resulted from that IV dose. And this will give you clearance. But does dose determine clearance? No. Is that the determinant of clearance? No. Is area under the curve the determinant of clearance? No. Of course, we can also use bioavailable dose rate over clearance. So if none of those things determine clearance, What does? Well, before we go on, I want you to be sure that you can determine the dependent variables in these relationships. So if we're talking about this first equation here, which one of these is the dependent variable? You tell me. Hopefully you picked this one. CSS average is the dependent variable here, right? So we would have CSS average is bioavailable dose rate over clearance if we were going to write it. So here's our dependent variable. Which is our dependent variable in this relationship? Hopefully you're all yelling K. Yes. Your elimination rate constant is determined by clearance and volume, isn't it? Clearance is not determined by K, and clearance is not determined by volume. Good. What's the dependent variable in this relationship? That's right, area under the curve. So we would rewrite this as area under the curve, IV, is equal to dose IV over clearance. Same thing, drug in over drug out, right? Great. So that's all for this one, guys. Thank you. I think, wait a minute, let me make sure. I think I just have these circles flying in. All right, I think we're stopping.